In 2024, India. A pregnant woman in rural Odisha collapsed on a dirt road. The nearest hospital was 85 kilometers away. No ambulance came. She didn't survive the journey, and neither did her baby. This wasn't rare. Every year, over 44,000 mothers die during childbirth in India, not because of disease, but because help is too far. But now, something massive is changing. 3,50,000 crore rupees, India's biggest healthcare investment ever. 22 new AIIMS, 75 medical colleges, 1,50,000 wellness centers reaching every village. By 2030, healthcare will reach where it never could before. Today, we break down 15 biggest healthcare mega projects that will transform India by 2030. And it starts with the one already reaching your village. Let's start with number 15, PMABHIM. This is India's biggest investment in health infrastructure ever. 64,180 crore rupees just for building the foundation. For decades, a farmer in a remote village faced death, not because treatment didn't exist, but because it was too far. Now, that's changing. Over 10,600 health centers are being built across India by 2026. These aren't small clinics. They have labs, beds, and trained staff. From Himalayan villages to coastal towns, care is finally reaching everyone. This project closes the gap between cities and villages. No Indian will be too far from a real hospital anymore. But here's the problem. What if people can't afford the treatment, even when the hospital is right there? That's where the next project comes in. Next is number 14, Ayushman Bharat, PMJAY. This is the world's biggest free health insurance by any government. 9,406 crore rupees is the budget for 2025 to 26. Before this, one hospital bill could make a family poor forever. Parents had to choose, save the sick child or feed the others. Now, 550 million Indians get free treatment up to 5 lakh rupees every year. A rickshaw driver needing heart surgery can get it and pay nothing. Over 27,000 hospitals already accept this card. No more selling land, no more heavy loans, just free care. But here's the big question. If 550 million people need treatment, who will treat them? India needs more doctors. And that's what the next project is building. Next is number 13, AIIMS expansion. AIIMS Delhi was always the hospital of last hope. When no one else could help, families traveled there. But one hospital cannot serve 1.4 billion people. Patients waited months for appointments. Many arrived too late. Now, India is building 22 AIIMS across the country. 8,000 to 12,000 crore rupees investment. Over 5,000 new beds coming by 2030. A cancer patient in Bihar no longer needs to travel to Delhi. AIIMS Patna is right there. Same quality, same doctors. World-class care, now closer to home. But AIIMS trains specialists. What about regular family doctors that every village needs? That's what the next project is solving. Next is number 12, medical college expansion. India has a big problem. Not enough doctors. In many districts, one doctor serves thousands of patients. Talented students from villages dreamed of becoming doctors, but seats were too few. Competition was too high. Most gave up. Now, that's changing. 15,000 crore rupees is building 75 new medical colleges, 75,000 new MBBS seats for students across India. These colleges are opening in underserved districts, not big cities. Students who train in villages often stay and serve there. A district with no doctors today will have hundreds by 2030. But training doctors takes years. What about helping patients right now using technology? That's what the next project is doing. Next is number 11, a BDM digital health. Imagine visiting a doctor in a new city. You have no files, no reports, no history. The doctor knows nothing about you. This happens to millions of Indians every day. Now, that problem is ending. 500+ crore rupees is building India's first digital health system. 80 crore Indians will get a unique health ID. All your medical records stored in one place. A worker from Chennai gets sick in Mumbai. The doctor there can instantly see his full history, allergies, medicines, past reports. No confusion, no repeated tests, just quick, safe treatment. Your health data will travel with you, anywhere in India. But what about Delhi, India's capital? It's facing its own healthcare crisis. Next is number 10, Delhi healthcare transformation. India's capital is getting a massive upgrade. 12,893 crore rupees investment. Anyone who visited a Delhi government hospital knows the reality. Patients lying in hallways, families sleeping on floors, waiting lists stretching for months. Not anymore. 16,186 new beds are being added across the city. 2 new medical colleges are coming by 2030. A person in East Delhi won't need to travel hours for good treatment. New hospitals will be closer to every neighborhood. Delhi's hospitals also serve patients from all of North India. So this helps millions beyond just the capital. But government isn't the only one building. One of India's richest men is doing something remarkable. Next is number 9, Azim Premji Hospital. This is not a government project. This is one man's gift to India. Azim Premji, one of India's richest people. He could buy anything in the world. Instead, he chose to build a hospital. 4,000 crore rupees investment, 1,000 beds, super specialty care. But here's the best part. It will be a charitable hospital. World-class treatment at prices common people can afford. A cancer patient won't lose their life savings for treatment. This proves that India's billionaires can change lives too. One hospital, one vision, millions of lives saved. But what happens when an accident strikes on a highway? Every second matters. And that's what the next project addresses. Next is number 8, critical care blocks. The golden hour, the first 60 minutes after an accident. This hour decides who lives and who dies. But in most districts, there was no trauma center nearby. Accident victims died on highways. Heart attack patients died in transit. Not because they couldn't be saved, but because help was too far. Now, 5,000 crore rupees is changing this. 621 trauma centers are being built across India by 2028. Every district will have ICU beds, emergency surgery, and life-saving equipment. An accident on a rural highway no longer means certain death. Help will be minutes away, not hours, but emergencies are rare. What about everyday health? Mothers, children, common diseases. That's what the next mission handles. Next is number 7, the National Health Mission. This is the backbone of India's healthcare. They are spending 37,227 crore rupees this year alone. This mission saves the most lives every day. It ensures every mother gets care and every child gets vaccines. It's about preventing death before it happens. But where do these workers actually see patients? India is building 1.5 lakh tiny hospitals to help. Next is number 6. Ayushman Arogya Mandirs. India has small health centers in almost every village, but most were empty buildings, no equipment, no real treatment. Now, 150,000 of these centers are being upgraded. They will have medicines, basic tests, and teleconsultation with doctors. A farmer with diabetes no longer needs to travel hours for a checkup. His village center can monitor his health and give him medicines. These centers also teach yoga, nutrition, and disease prevention. Not just treatment, but keeping people healthy in the first place. 150,000 centers, more than most countries have in total. But what about India's factory workers and laborers? They need their own healthcare system, and it's coming. Next is number 5, ESI expansion. India's factory workers, drivers, and laborers power the nation. But for years, their health was ignored. Now, 3,500 crore rupees is changing that. New ESI hospitals are opening near factories by 2028. Workers and their families get free treatment, maternity care, and injury support. A textile worker in Surat no longer travels hours with a broken arm. He gets treated right next to his factory and returns to work faster. Over 3 crore workers are covered, more than some countries' populations. But these hospitals need medicines, and India is now making them cheaper than anyone else. Next is number 4, pharma sector transformation. India is already called the pharmacy of the world. We make cheap medicines that save lives in poor countries everywhere. But during COVID, we learned a hard lesson. When other countries stopped exports, India struggled to get raw materials. Never again. Now, 15,000 crore rupees is making India fully self-reliant. New drug factories, vaccine plants, and medical device units are coming. India already makes 60% of the world's vaccines. Soon, we won't depend on anyone for medicines. A life-saving drug that costs 1 lakh rupees abroad, made in India for 5,000 rupees. But modern medicine isn't everything. India's ancient healing system is also getting a massive upgrade. Next is number 3, Ayurveda expansion. India gave Ayurveda to the world thousands of years ago, but for too long, it was treated as second-class medicine. Not anymore. 800 crore rupees is building a 500-bed Panchakarma hospital by 2027. World-class research labs, trained Ayurvedic doctors, proper clinical trials, ancient wisdom, now backed by modern science. No other country has anything like this. But while Ayurveda heals with tradition, technology is changing medicine too. Next is number 2, digital health and AI. The future of medicine is here, and India is building it. 8,000 crore rupees investment by 2030. Robotic surgery systems in government hospitals. AI tools that detect cancer from X-rays in seconds. Telemedicine connecting village doctors to city specialists. A village doctor sees a strange skin problem. He doesn't know what it is, but his AI tool tells him instantly, like having a specialist in his pocket. A cancer patient in a small town needs complex surgery. Robotic surgery, guided by experts from Delhi, saves her life locally. India is not just using this technology. India is building it for the world. But there's one more project left, bringing super specialty care to small cities. And finally, number 1, super specialty in smaller cities. This is the project that changes everything. Heart surgery, cancer treatment, organ transplants. For decades, these were only available in Delhi, Mumbai, or Chennai. Patients from small towns had to leave everything, family, home, jobs, just for treatment. Many simply gave up. Now, 2,000 crore rupees is bringing super specialty care to Tier 2 and Tier 3 cities. By 2027, Cities like Raipur, Varanasi, and Kozhikode will have world-class facilities. A grandmother needing heart surgery won't travel 1,000 kilometers anymore. She'll get it in her own city, near her family. Young doctors can now build careers outside big cities. No more brain drain. No more inequality. Your PIN code will no longer decide if you live or die. And now, when you look at all 15 projects together, the picture becomes breathtaking. 3.5 million crore rupees, $42 billion, 15 mega projects, all happening right now. By 2030, India's healthcare will be completely transformed. 10,600 health centers, 22 AIIMS, 75 medical colleges, 150,000 wellness centers, 80 crore digital health, IDs, super specialty care in small towns, AI in village clinics. No nation has ever attempted this, at this scale, at this speed. The India of 2030, where your village has a clinic, your phone has your health records, and your life doesn't depend on your PIN code. This isn't a dream. It's already being built. 15 mega projects, 3.5 million crore rupees, 1.45 billion lives, from village wellness centers to robotic surgery, from digital health, IDs, to ancient Ayurveda. India is building healthcare like never before. By 2030, your health won't depend on your wealth or your location. It will be your right. If this video opened your eyes, subscribe for more stories that matter. Now tell me, which project will impact your life the most? Drop your answer in the comments below.